You mentioned in regards to funding, this is an organization that openly advocates for the reduction of alcohol consumption. They do get government money. That strikes me a bit of an odd balance in terms of the relationship between NGOs and government. I think of a scenario where if you gave funding to the oil and gas lobby to determine whether or not we need more oil and gas, they're obviously going to say we need more oil and gas. Do you think that taints the findings of the report, given that we know that their mission for the organization is so plain and clearly stated?
I would say so. I mean, when it comes to agri-food, it would be like asking PETA or a vegan group to comment on the beef industry, for example. That's kind of what it looks like. But the center appears to have a lot of influence from a policy perspective, which is really questionable. Since I actually published my op-ed last week, we've been approached by several groups who do advocate for different things, and there are major question marks here in terms of how the lobbying is being conducted, who influences who, and how guidelines are set by Health Canada. So it's going to be interesting to see exactly how things unfold. But for the time being, my impression is that this center in Ottawa appears to have this monopoly when it comes to our collective conscious and alcoholic consumption, I guess.
Yeah, and it's a strange kind of loop or cycle with the government using taxpayer money to fund a report, which then is used to lobby the government on policy.
Exactly.
It's something that, I mean, under other circumstances or other issues would probably raise a lot of red flags, not just with taxpayers, but consumers, anyone who cares about that level of transparency. In regards to the CCSA's report, how do you feel they balanced or managed the benefits of alcohol consumption, whether that be for human health or the social aspect? I mean, you mentioned Canadians enjoy consuming alcohol. We do so in most instances in a responsible way based on the previous guidelines, in social settings, talking with family and friends, special occasions. Do you think that was missed or is missed in some of this discussion?
A little. I think context is quite critical here. I think as a society, as a nation, we need to take stock here in terms of what's happening right now, post-COVID, leaving the pandemic. We all know that sales are up, and I think the real question we need to ask ourselves is Canada drinking too much? And if so, what's the threshold here? But we also need to be realistic in our approach. I mean, we can't just go back to prohibition years and encourage people not to drink at all. It would be an unrealistic view, and that seems to be what it's transpiring right now. That's the message that I'm hearing from the center. And so we need to strike a balance, but we also need to understand exactly what the legacy of the pandemic is from a alcohol consumption perspective is, and see exactly how we need to articulate a message in order to encourage Canadians to drink responsibly.
Yeah, I mean, you raise a very good point. There were a lot of headlines about alcohol consumption going up as people were stuffed away in their homes for so long. And I think for a lot of people, some of that can be understandable, but there's a serious public health question. Did we create new norms, and are those norms unhealthy? Would it be too early to tell whether those norms are unhealthy? Is there a lag there and where we can see maybe some of that lasting impact in terms of consumption in the pandemic, or is there any data available to us?
Well, when you go back to the report, they did review over 5,000 studies, but very few of them are related to are using post-COVID data, and I think it's a different market when it comes to drugs, alcohol, and cannabis as well in Canada. So I think we need to better understand exactly where we're at right now in order to provide the right guidelines. And frankly, does it mean that we need to change our guidelines? I don't know. But does it mean that we need to change how we educate the public, how we build awareness? I suspect so. I think
Yeah.
we need to talk about this.